Hey there, my name is Melannie Teitsma. I'm a Manitoba student nurse in Skills 2, Section K04, here to demonstrate my medication administration part 1. So today is February 7th, 2021, and it's 7:40 in the morning. So I'm going to administer the scheduled medications. I'm going to start by comparing my doctor's order and my MAR. So Jake Nursing, 312-654-654-98797. Date of birth is January 1st, 1960, January 1st, 1960. Doctor is Dr. Skills Lab, and there's no known allergies, but we'll double check that at the bedside. Now I've got ondansetron 6 milligrams, intramuscular daily, before supper, signed off twice, given every day at 1700 hours. And then heparin, 5,000 units, subcutaneous, daily, signed off twice, given daily at 800 hours. So I'm only going to administer scheduled medications, so since it's 0740, we're within the half an hour timeline of giving the heparin. So that is the medication I'm going to be giving. My patient was admitted for uncontrolled nausea and vomiting secondary to chemotherapy, and I've also added in that the treatments and the illness have made them less mobile, so I am giving them heparin to kind of prevent the clot formation. So now I'm going to put my doctor's order away in case somebody needs it later, and I'm going to select out my correct medication. So I have selected out heparin, which is 5,000 units per 0.5 ml, so we're going to be drawing up 0.5 ml. And I see that it is a single dose vial, so we're going to be discarding the vial once we've withdrawn a medication. We can give it subcutaneous, and it is not expired. So this is the correct medication to give. So now I'm going to compare it with my monograph, and I see that it is a high alert medication, but that's mainly if you're giving it IV, and we're giving it subcut. And it is an anticoagulant. And as I mentioned, it can be administered by a student nurse, and the normal dose is 5,000 units subcut every 8 to 12 hours, and we actually give 5,000 units every 24 hours, so we're within a safe dosage range. So now that we know that, I'm going to perform hand hygiene. I'm going to select out my correct needle. So I've selected out my 3 ml syringe here, and I've chosen to use this because I find that the lure locks are much more stable and I can still draw up half an ml very accurately. And then I've also got my 25 gauge 5/8 of an inch needle. I chose this one because it fits within the subcutaneous parameters, and also I have in the scenario made my patient larger, so I wanted to choose a needle that is on the longer side of the subcut spectrum. If my patient was skinnier, I might go down to a 1/2 inch, and I would adjust accordingly. And then lastly, I've also got my blunt fill needle, which is not a filter needle since we are using a vial. So now I'm going to take my vial, and I've opened it, and I'm going to wash it in a circular motion with an alcohol swab for 30 seconds, and it's been 30 seconds. So now I'm going to take my 3 ml syringe and my blunt fill needle, peel back in a butterfly formation, and I'm going to connect them without contaminating the hubs, just like so. Now I'm going to move the plunger back and forth without contaminating the plunger itself, just to make sure there's no resistance. And I'm going back to 1/2 ml there. Now I'm going to safely uncap, inject straight down, inject 1/2 ml of water, flip, 1/2 ml of air, not water, flip, and get out my medication. Okay. So I'm going to withdraw, and I've drawn up a little bit more than I need, just so that we don't lose any, we don't lose our accurate dose when we're changing needles. So now I'm going to pull back, get rid of bubbles, okay, and just doing that without contaminating the plunger. I'm going to recalibrate, and I see that we still have just a little bit more than 1/2 ml, so I'm going to withdraw again. And I'm going to detach my blunt fill needle, and I'm going to attach my safety guide needle, and so I'm going to attach it without contaminating the hubs and without contaminating the plunger. Just connect on like so. And now I'm going to recalibrate my dose, and now I see that I have exactly 1/2 ml, and I have a bleb at the top, so there's no need to utilize the med waste in this case. So now that I've made that, I'm going to immediately make a med label. So correct patient is Jake Nursing, correct drug is heparin subcut, correct dose is 5,000 units, correct volume is 0.5 ml as we checked with the vial, and the correct time is February 7th, 2021, and it's about 7:45 in the morning. And my name is Melannie Teitsma, Manitoba student nurse, and I am authorized to give this medication at this time. So now that I have drawn my medication and I've made the label, I'm going to do my second check where I'm going to compare my MAR with my medication with the medication label with my actual syringe. So first of all, correct patient, Jake nursing. Correct drug, heparin, subcutaneous, and heparin. And correct dose is 5,000 units. This is 5,000 units per 0.5 ml. And I see that I've drawn up exactly 0.5 ml with no bubbles on this syringe. So that's perfect. And correct route, subcutaneous. This can be given subcutaneously, and I chose a needle that is within the subcutaneous parameters, as I had a 25 gauge with a 5/8 of an inch needle. So this can be given subcutaneously. And correct time is always given at 0800 hours, and it's about 7:45 right now, so we're within the half an hour boundaries. So now that I've completed my second check, I'm gonna discard of this in the med waste, and I'm gonna collect the supplies I need. So I'm gonna have my MAR, my medication itself, a pen, a pair of clean gloves, an alcohol swab, a cotton swab, and now I am going to enter the room and I'm going to introduce myself. Hi, my name is Melannie Teitsma. I'm your student nurse for today, and I'm here to give you your heparin injection. So when I am introducing myself, I'm making sure to do my entrance safety check. So I'm looking for any hazards. I'm making sure my patient isn't in any distress. I'm making sure to monitor that their call bell is within reach and their bed's at an appropriate height. So now that I have checked all of that, I'm going to go down to my patient's bedside and I'm going to ask them to state their name. So can you please tell me your name? Jake Nursing, and I'm comparing that with the MAR and with the wristband. So what is your name? Jake Nursing. What is your date of birth? January 1st, 1960. And I also see that the FIN 312, 654, 9797, and the Dr. Skills Lab all matches up. And Jake, do you have any allergies? My patient says they have no allergies, and that matches up with our MAR, so we know this is the correct patient. So Jake, I'm going to do my last check up on the top of your bed, and then I'm going to come down to you and kind of tell you a bit about the medication, okay? So my patient consents to this procedure, so now I'm going to do my final check, where I'm going to compare my med and its label to my MAR. Can you see? Yep, there you go. So correct patient is Jake Nursing. Correct drug is heparin. This is heparin here. Correct dose is 5,000 units. It was 5,000 units per 0.5 ml, and I see that I've drawn up exactly 0.5 ml with no bubbles. So this is the right dose to give. Correct route, it's given subcutaneously. Heparin can be given subcut, as we checked on the vial and in the parental drug monograph. And also this needle size is a 25 gauge with a 5/8 of an inch of a needle. So that is good, and it fits within the subcutaneous parameters. And correct time, 0800 hours. Right now it's about 7:45, so we are within that half an hour boundary and we can administer this medication. So now that I've finished that, I'm going to talk to my patient a bit. So today I'm giving you your heparin injection, and so I'm going to be giving it in your abdomen. So I'm going to go 5 centimeters away from your umbilicus, and I'm going to choose a quadrant that doesn't have a lot of bruising and just find a spot there. So heparin is an anticoagulant, so it's used to kind of prevent the formation of clotting. Just because you have decreased mobility these days, we want to prevent the formation of clots that could complicate your condition. And so I already checked with the physician. Generally, we like to avoid giving heparin to people that are over 50, 60 years of age, and you are 61, but I double checked with the physician, and we do have a good reason for giving it in this case. So that's good. As far as other contraindications, we know that you do not have any contraindications, and some side effects include irritation around the injection site, and then also you can get a headache, and you can have some extra bruising too. And so if you notice that the bruise around the injection site is getting larger, or if you notice any bruises around your body, please let us know. And so as far as assessments go, I have checked all of your vital signs, especially making sure that your blood pressure isn't too low and your pulse isn't too high, so that could signify a low blood volume, which could mean a bleed in your body. And I've also continued to monitor your blood work, especially looking at your ABTTs to make sure your clotting time is within a therapeutic range, and that's all looking good. So do you understand this drug and what it does? And so my patient consents to getting this drug in their abdomen, and I'm going to go forward with it. So I'm going to bring this down. Please don't fall, please don't fall, please don't fall. Okay. And so I am going to perform hand hygiene, and then I'm going to take an alcohol swab, and I'm going to take the site that I landmarked, and I'm going to wash it in a circular motion for 30 seconds. Let's just adjust it a bit. And so for this, I actually like to put my gloves on after, because otherwise I find my gloves just get too slippery, and then it's hard to stabilize later. So now I'm going to discard that, and I'm going to put on my gloves now. And of course, I do hand hygiene before this, as I already verbalized. So with a subcut injection, you give it 45 degrees for every inch of tissue you can grab. And in this case, as I said, my patient is larger, so I'm going to be grabbing 2 inches, and I'm going to go in on a 90 degree. Can you see okay? Okay. So I'm going to safely uncap. I'm going to pinch the area. I'm going to go in like a dart. I'm going to stabilize without letting go of my pinch. I'm going to inject. And now I'm going to wait a few seconds. I'm going to remove my stabilization, remove the needle, remove the pinch, and I'm going to activate my safety and throw it in the sharps. And then I give my patient a cotton swab to press against the area. And so now I'm going to lift you. Please don't fall. Please don't fall. Okay. So now that I've administered that, I'm going to take off my gloves. And I'm going to perform hand hygiene. And I'm going to make sure that my patient is doing okay and they verbalize that they are doing all right. So I'm going to sign on the MAR that I've given the medications. So Melannie, Teitsma, U, Manitoba, student nurse, your choose, because that's my designation. Then also the time. It's only 100 hours right now. And so now that we've documented that, I'm going to talk with my patient a little bit longer. So my patient feels comfortable with the procedure, and so I'm just going to tell him a bit about what I'm going to be monitoring. So we're going to be checking that the clotting is actually working. Right now we're at 12 minutes, okay. So that we're kind of preventing clotting. So what that's going to look like is we're going to make sure that, say, your extremities aren't getting too cold. We're going to keep monitoring your vital signs, and going to get you to keep looking out for bruising, because if it does end up having any bruising, that could mean that there's a bleed somewhere in your body, and that's something we would need to know. And so I've verbalized all of the assessments and what I will need to be watching, and I've already documented all of my assessments in the nursing binder as needed. I signed on the MAR, and my patient feels comfortable, so I'm going to do my exit safety check, where I'm going to check that their call bell is within reach, my patient's comfortable, their bed's at an appropriate height, and there's no hazards. So now that I've done that, I'm going to leave the room, and I'm going to end my demo. Have a great day.